Okay, so once you've listened to the left hand side, you need to come round to the right hand side, and again you need to palpate for an apex beat before you start. Now, in most horses, you're not going to feel it. Very thin chested horses, you might feel it, but you should always feel, because at the very least you might actually feel a thrill of a very, very severe murmur. So you should palpate to start with. And if you do feel an apex beat, then it's a good place to start. It's a lot further cranial, so I'm already starting off behind the elbow, behind the triceps, right up in the pocket there. He's not stood very well. Let's see if we can get him to stand with his right leg forward. Still not very good. And I can't feel an apex beat. So I'm just going to start auscultating on the right hand side, and I'm going to make sure that the diaphragm on my stethoscope goes right far forward, pushing upwards behind. And I need to stay there, and again I can assess the rate and rhythm and then listen for the heart sounds I can hear, and then I can move around a little bit in this pocket and make sure again I've listened to the whole area. And on this side, we're mainly listening over the point where his tricuspid should be. So if there's a murmur associated with the tricuspid, we might hear it in amongst the heart sounds on this side.